Welcome back. You're still watching Citizen Extra with me, Fred Indimuli. Now, we want to get into this conversation about universal healthcare. It is one of the pillars of President Uhuru Kenyatta's Big Four agenda, but what exactly does it mean? Does it equate to free medical care for all Kenyans? If not, if we still have to pay for medical services, how much will it cost? Is it even possible to make healthcare affordable for all? Yes. What about NHIF? Is this scheme that has been in existence for over 50 years the best vehicle to take us to that destination of universal healthcare? Now, we'll be having conversations with different people, and I have to say this on air, that yes, we had invited the management of the fund, the NHIF, the National Hospital Insurance Fund, for this particular discussion. They were not able to make it this morning, but we'll continue with the conversations nonetheless, with NHIF as just one of the facets of this conversation. With me on set now is Geoffrey Ogechi, a beneficiary of this fund, the National Health Insurance Fund, NHIF. Geoffrey, good morning, karibu sana.
Good morning to you, asante sana.
Well, there are at least 12 million Kenyans who are still not registered with NHIF.
Yes, true.
Yes?
Yeah.
They do not get to enjoy any of the benefits that you have enjoyed.
Yeah.
Currently, just try and outline what NHIF or the kind of benefits you've enjoyed,
right,
and what does it mean for you to have that cover by NHIF?
Okay, thank you for this opportunity and for welcoming me here. So for me, earlier last year, I was diagnosed with bladder obstruction.
Mm-hmm.
Blood obstruction.
Yes.
Yeah, so my bladder was not emptying everything from my body system. So I went to seek medical advice. So I went to one of the checkups several times. So they advised me that I'm supposed to go for surgery. Mm-hmm. And the bill was supposed to be
250,000 shillings?
Yes.
For that surgery?
Yeah.
Was that an amount you could afford?
No, because before we have used a lot of money with the family, raising money, looking for the checkups and funding everything, medical, everything.
Mm-hmm.
So I asked the family, what are we supposed to go about this one? So one of our friends advised me, like, NHIF can at least sort you out. They can give you even the amount, half the amount of your bill. So we approached NHIF. Purposely I went to NHIF Upper Hill, where they told me, like, you can offset half of your bill, mm-hmm, which is 100,000.
Were you a member by then, or
yes,
you
I was
became
a member
after?
I was a member.
You're already a member?
Yes,
okay.
I was a member. I was contributing, that is.
Mm-hmm.
So,
through your employer?
Yes,
mm-hmm,
yeah.
Okay, and what happened after that?
So, the hospital has scheduled surgery on it was on 24th, yeah? Mm-hmm. So they told me, we just approved this bill, then you go for the day you are going for surgery, just make a call. You can be able to talk to the hospital, which is Coptic Hospital, where my surgery was done. So when on 25th, like, we just went to Coptic, we make a call, then they generated everything. They give, mm-hmm, them the invoice. They were like, everything's free now. You can just take your medical. Initially,
they were to offset half,
yes,
the bill.
Yeah.
They ended up paying 100%?
100,000.
100,000?
Yes. 100,000.
And you paid the rest?
I paid the rest.
Yes.
Yeah.
And for you, that was of great help?
It was.
Uh-huh.
Yes.
Because not many people can afford that kind of amount, especially when you're afflicted by any illness or condition.
Yeah.
There's so many people, the 12 million Kenyans who are not part of NHIF.
Yeah.
Do you think that it is possible to have all of them covered under NHIF?
Yeah, it's possible for all of them to get covered, because the contribution amount they make every month, that's 500, at most 500, yes, per month. Mm-hmm. It translates to a lot of money, as in for your health. It doesn't matter how much do we spend in a month, mm-hmm, which we use like our luxury,
yes,
which we're supposed to care about our health.
Mm-hmm.
Like for NHIF, people assume like NHIF just caters for, mm-hmm, government hospitals. Trust me not. NHIF caters for even private hospitals.
Okay.
Yeah.
Because Coptic is a private hospital.
It's a mission hospital.
Yes.
Yeah.
And probably I should ask you, how did the surgery go?
It went on well.
Yes.
For me, I was like, wow, how am I supposed to, cause I never had something like I can go under a knife.
And come
and it was not about knife. They were doing it as a lesser shit.
Okay.
Yeah.
And now you're fully healed?
Yeah, I'm fully ill, but the issue now is like my how can you call it? my immunity
Yes.
is low, but
Okay.
I'm working on it.
Okay.
Yeah.
And you're still covered under NHIF?
I'm still covered, yeah.
Now, you were lucky, at least you were employed and you're contributing to the fund through your employer.
Yeah.
But I'm sure you have colleagues and friends who are not employed.
Yes, I do.
Do you think it is possible for them to also get under that umbrella of cover?
Yet it can. But for me, what I will get the government, like, reduce just the amount, you know.
The contribution to NHIF?
Yeah, yeah. I know it's okay, 500 is the standard amount, but I can just ask for the government. Maybe they can just pay half for those who are not employed. Yeah, not everyone is the same. Some people are not employed, they don't have a job. They undergo their business
Yes.
to put a food on the table. At least the government can pay a half for them.
Okay.
Yeah.
So you think the government should come in,
Yes.
try, but are they able to pay even that half, if at all it was less? if for the 500 shillings, if the
Yeah.
government said, okay, fine, we'll pay half for you,
Yeah.
are they able to contribute the rest? Because the people who really struggle. and
Yeah, they
don't-
struggle.
Yes.
Yeah, it's true. Sometimes many people, they're not even able to pay. So the government is supposed to look into it, as in maybe they can put a certain amount for employed people
Yes.
and the self-employed people, like they have a small business where they get money for their food to put on the table.
Okay.
At least some amount.
Okay.
Yeah.
Well, that's just one of the stories we have of young Kenyans who are getting to enjoy medical cover benefits from NHIF. Remember, that is just the state-funded parastatal. There's private health insurance as well. This is just one facet of universal healthcare that is now one of the pillars of President Uhuru Kenyatta's Big Four agenda. Well, time now to take a break. When we come back, we'll be talking to a healthcare advocate on the bigger issue of universal healthcare and to help us understand exactly what it means and how can we achieve it as a country. That when we return.